Okay, what I want to show in this quick video is a case study creation workflow. I'll use the example that we used in the Wednesday cohort as an example, and then we also have the recorded session from the Monday that shows a very similar case study. Something I want to bring your attention to real quick is in our shared AI assignments for review section, I included this briefing document. Essentially, what I had asked ChatGPT to do is I gave it a collection of my case study creation conversations and asked it to create a briefing document. This will be specifically for MNT case studies, but it has sample prompts with things to include. It'll have recommended case packet sessions, a quality review checklist, follow-up questions if you wanted to add a multiple choice or short answer component to the case study questions, and then a quick fill-in worksheet where if all you did was copy and paste this, that would have all the information that's also included in the prompts. So whichever way is kind of easiest for you to work with. I try to make this a little more template so that you'd be able to kind of fill in what you would want a case study for. So find this document. This is a draft. I definitely want to get your thoughts on this. So if you could spend some time in the review tab, that would be fantastic. But here is the case study. So what I did with this, and you can do this kind of one, two, or three ways, but I want to build a case study for my students to prepare or to practice applying their MNT skills. I gave some information. I want these kind of anthropometrics. I want their diet recall showing a quote unquote lower calorie intake. There's some physical activity. There's some other social history. Essentially, what I want you to see as you read this, and you're welcome to pause it, is that I am trying to include the ABCDs of nutrition assessment, anthropometric, biochemical, clinical findings, and dietary assessment, all within this format. This was the case that we put together with the Wednesday group. And I also attached the specific obesity slide deck that I have as a reference point when we get to the question components for the case studies. But even just with this simple prompt, it's not even as detailed as it would be if you followed the full checklist. We get a very comprehensive case study. Mr. Javier Ramirez, 52-year-old male, Hispanic Latino. We get this little vignette of his social history. We have a reason for the referral for GLP-1 therapy onset. He's scheduled to begin next week. Here's some social and lifestyle history, some medical history. What I want you to see here is that even without very specific information, we're getting some pretty good information that's consistent with the obesity case study. We see 5'10", 233, BMI of 33. I typically check every math portion that's done from a language model just to confirm this one was good to go. This one gave me a waist circumference. This is consistent with our case. I get other information like a usual adult weight, highest adult weight, patient stated goal, weight change in the past year, current weight pattern. Here are our medications and our supplements, depending on what level of students you have. You can reduce this, add to it. I like to have a portion of my case studies where students are able to identify what medications and what class of medications and what did they do. So this is helpful for my particular cases. We asked for some physical activity. Here it is. This person is a little bit more active um, than probably most in this kind of case. So you can adjust this. If you want them to be sedentary, you can make them sedentary. Um, I specifically asked for some sleep and obstructive sleep apnea history, only because in my specific slide deck we address sleep apnea as one of the very common comorbidities with obesity. Then here's our 24-hour recall. This one, because we asked in the initial instructions for it to be on the lower end, ended up being quote unquote maybe too clean of a 24-hour recall. So I would probably want to change this up. And so what you could do is that you could just highlight this and ask ChatGPT directly, and then we can only change the 24-hour recall component of this if you wanted to only change a specific part of it. A little information about the weekend pattern. Here's some biochemical data. Something to note, if you don't get something this polished on the first try, is that in my custom instructions, I uploaded what a typical CBC, CMP, and BM and a lipid panel looks like. So it's pulling those reference ranges directly from there. I didn't leave that up to chance because I used to have major problems with lab tables where I would get calciums of like 1,000 because it didn't know what to reference. And so maybe even uploading an example of what one of your case studies looks like would be helpful in order to get a similar formatting. But here, I do like the slightly elevated glucose, and ALT is being slightly elevated, but with a quote unquote just obesity case. This looks fairly consistent. Our CBC is normal. The lipid panel shows elevated total cholesterol, LDL, a lower HDL. This all looks good for a first try. And then if there are specific things that you want them to address, of course, you can edit these as you see fit. Additional labs, we specifically ask for an A1C, a CRP, and a TSH. Again, you can add or remove as many labs as you would like, depending on what your learning objectives are. Here's our clinical findings section. And then without asking, it went ahead and gave me a student assignment. This is probably because the memories I have within my specific ChatGPT knows that I've asked for this in the past, so it's trying to anticipate my needs. But in this case, this is too much information. I'm not ready for questions yet when I want to refine the prompt. And so here, I just a very simple question. I want a different take on the 24-hour recall, something closer to 2,500 to 3,000 calories and fast food for dinner. And so here's my revised 24-hour recall. This is closer to what I would want it to be. And of course, you can still edit this however you see fit. Some teaching comments. Okay, so now I'm telling it 24-hour recall looks fine. Be sure to remove the estimated calories before making this to a student-facing document. And now let's see a draft Word document. So it took about 5 minutes to create this Word document from the case that we made. It's in this color formatting because that's what I had asked it to do previously. Texas Tech is red and black, so I like the red coloring. And then this is everything that it gave me in nice little tables. And again, from here, you can edit this however you see fit, however you like to present this information. If you would rather remove some of the family history so that they have to quote unquote ask for that, you're welcome to do so. But everything is here, at least as a draft for you to edit. It even added in some of the student assignment information. This is how I like to do it. And of course, we're all going to kind of address this different ways. My typical case study workflow is here's the case, here are some multiple choice and short answer questions. They will do their assessment note, and then they'll do the oral review of their assessment note. And then depending on the case, they would also have the chatbot version of the patient that they would then practice giving the education, practice administering the MNT for those particular patients. But this is my typical workflow. I think this is helpful, at least as a draft. Again, everything that we're creating with the AI tools should always be seen as drafts. We're going to go in and edit and fine tune to whatever's our preference. But okay, so now we have this document, and now I want to go to the next step, which is creating the short quiz or the multiple choice and short answer questions. What I didn't like about chat is that it didn't let me review them first. It went ahead and created the documents. But you can go ahead and look at the instructor answer key. Again, this was done in, how fast did chat do this? In 3 minutes. Off of the same case, here are my multiple choice questions. You can ask for as many of these as you'd like. What I have found is that I usually like about half of them, and then I ask it to, okay, well, give me 10 more. And even if I like a question, I might not like some of the answer choices. So there's a lot of back and forth. Again, this is just like you normally would. We're going to refine questions to fit our learning objectives, to make answer choices in a way where they have to show that they understand the concepts I like short answer questions. I like that it even provides me some suggested answers that are based in the case study and in this example also in my slide deck because I attached it as a reference. But this is great. And so now I don't want to copy and paste all of this because that would take me 5 ever. And so what it did do for me is it also gave me the Canvas upload package because I specifically said I want to upload this to Canvas easily. Canvas and Blackboard both use the QTI file format. And so it'll give you the zip file. And so if you're in Canvas, here is the workflow. You're going to go to settings. You're going to go to import. We're going to drag this down to the QTI file. We're going to upload it to the one we got. You can make a test bank if you want. We're just going to put random things. In my Canvas, I have to unclick this new quizzes button for it to work, but then I just add it to the queue. And this will take a few seconds. This doesn't take very long at all. There's also another video that's just specifically on this Canvas component in the YouTube playlist. If you want to go ahead and cut it off now. But I wanted to show you the full thing all together. Okay, so now we're going to go to quizzes because it was a quiz file. We're going to see it unhighlighted because it came in as a classic quiz. I'm going to migrate it to the new quizzes format to be consistent with the other ones. But while that's loading, I'm going to go ahead and just check the questions to make sure that everything came in the right way. And I can see here, it even kept the general answer comments, but here is the question, here are the answer choices, here's the correct answer. We're always going to verify these things to make sure everything is good, but here's our 10 multiple choice, and here's our 10 short answer. Very, very fast. And so now this is good to go in the new quizzes format. We're going to just do the same thing to make sure it converted over the right way. And if you prefer to do the editing inside of Canvas, then you can also go ahead and do the same thing you normally would. Then here we can make sure that we assign points, due dates. If you know that ahead of time, you can also ask that before it creates the QTI file, and it'll upload with the assigned points. You want 5 points multiple choice and 10-point short answer. It can do all of that for you. But here's our short workflow. Again, I hope you spent some time in the case study briefing document, and I hope you find that helpful to actually create different kinds of case studies for the various disease states that you might teach in your classes. But that'll be it for now.